are here? Why we are here? Why? We are having a summit. It's a first national South African summit of community health care workers.
The struggle of CHWs is very big in South Africa. It starts with the non-recognition of community healthcare workers as workers. And it also goes beyond that. It starts from them going to the households doing their work without proper and good working conditions. They go out there without any provision of occupational health and safety. The money that are getting paid is so little so that they cannot even survive from it. The healthcare system in South Africa, it cannot function without CHWs because we work as a link between communities and the state institutions like your clinics, your hospitals. Nurses, professional nurses in the institutions, they do not go to the households and see what is happening there. But the CHWs, they are there.
Since I was a little girl, I want to be a nurse because I care a lot of people. I'm not scared of anything. I like to help people so that they heal. I'm doing home-based care. I'm doing screening. I'm doing health promotion. Give health education about lifestyle, about good habits. I give them their medicine on the point. Everything I do as a community health worker. I'm working here alone. I am the only one CHW here within this community. Some call me a nurse. Even I'm not a nurse, I'm not a qualified nurse. But the things that I'm doing for them, they appreciate a lot.
Ogogo nje ugogo like njengamaphilisi akaze aza aye ekliniki phezulu uyamsiza ukuthi amlethele la ekhaya. Ya noma umuntu megula uyakwazi futhi azomsizela ekhaya. Yebo impela uyasiza bandla. Yasisiza. Ngoba musu uqinekile uyakwazi ukuqashela akufonele ile ambulance.
Yeah, everything is above our shoulders. Because someone who's raped, come to me, tell me. Someone who's beaten by the husband, tell me. Someone who's do everything, I must care. I must care. I must listen. I must do this. I must give a direction. From here, you must go there. And Sinani is I don't know what to say about Sinani. It's our mercy, Sinani. Sinani is helping us a lot to give up this stress we are getting from the community.
I think the most important one is to be there for them, to be with them whenever there are issues, because in terms of the guidance we can provide or support, because as I've said earlier, that with the departments, this kind of support they don't get in terms of self-care, also with debriefing. So as NGOs, that's where we come in and also create that platform for them to be able to talk, come together, sharing their ideas, mostly what is good that they are doing and how are they going to overcome those kind of challenges.
In the expedition to Northwest.
Medico International have been working with several NGO partners in South Africa for many years, and through their work with these partners they identified certain common themes, particularly around the well-being of community health workers, and they then brought together these 5 NGO partners in South Africa to explore this idea of, is there a common theme that we could work on collectively as a networking and advocacy project, which was quite a new initiative for many people. Yes, there are very common content themes around community health worker well-being, but the partners have very different ideological foundations and strategies and methods, and this I thought was going to be a challenge. You have Section 27 is a kind of young, funky lawyers, very professional, kind of modern NGO activist, if you like, and then you've got Kanya, which is this political conscientizing education, Paulo Freire movement building, kind of grounded activist, and then Sinani, which is the very much based in the KwaZulu-Natal, this idea of respect and this gentle psychosocial support, collaboration, let's work together with community structures and politicians and traditional leaders. And then Wellness Foundation, which was much more about provincial structure building with a psychosocial element. And then PHM, which is this much more globally situated movement on health rights and health activists. So these 5 very different organizations with different ideologies, different strategies, different methods.
The role of organization like Medico supported this movement, like the community healthcare workers, because not all funders will wish to see a movement that will be empowering community members, that at the end of the day that will say to government, no, and enough is enough. Most of the funders will tell you that we cannot fund you for democratic change, we cannot fund you for this, we cannot fund you, but we can fund you for programs. If you cannot fund real issues of the country, then you're literally not funding us. We need fund also to be funded to effect change, to challenge politics of the country, because everything that we're doing, much is politics, but also we need money to change those things.
We invite the departments of health, departments of social development. I wish they will come so that we can speak to them, because we try to speak to our local levels. There's no one who's listening. We make a lot of noise, no one listening. So we decide to do this at national level. Maybe they will hear these voices of ours.
Then let me introduce my speakers. I've got Ntate Bennett Asia from Gauteng. Then I still have National Department of Health. I've got
I'm really grateful for the invite for us to come and be with the community healthcare workers. I do believe if we invest in community healthcare workers, then we'll be able to actually, reduce the burden of disease at a community level and ensure that the people that goes to facilities are actually the people that need to be seen by a professional nurse. So in that case, it would be a huge saving for the government, and also a huge saving for us and a benefit for the community. I mean, because going to a clinic for things that could be attended to at home, we have to take a day off from work. It's costly even to the person who needs to access the service. So yeah, it is a very important role.
Kon ons nie die geld gebruik het vir iets anders nie. Hoekom moet ons nou net uitgeskop word en gesê word, oh well, we don't know what to do with you guys. That is also not on. As I said, we've been groomed by the Department of Health, by NGOs, by whoever. We are doing the job. And I said, nothing without us, about us. So please help us in the Western Cape.
The person who knows the story and the struggle is you. We built up our own case. We made our own papers that were submitted. So in 2016, we decided to take the department to the Labour Court to clarify this thing of volunteer service provider and all of that. Then on the 18th of March 2016, Labour Court declared us to be employees, not volunteers, employees of the Gauteng Department of Health. It took years. From 2016, we went to the reconciliation, and then it was set for arbitration. We went for arbitration, it was postponed. As the Department of Health is here, let them give us the permanent they've promised us. We won't wait for another 5 years. We won't wait. We won't wait. Amanda!
You are at House of Movement 123 Preacher Street. It's an office of the Gauteng Community Health Workers Forum. Well, we started organizing ourselves at as community health workers with different challenges from different regions. We're based in Gauteng, so we started this in 2012. Gauteng Community Health Workers Forum is an organization where it's run by the carers themselves who are actually doing the work. In Gauteng, we've got 9,000 community health workers is the total. So going clinic by clinic, making people aware of their rights and everything, that's how we were able to organize the forum. Currently now we've got around 2001 carers that we are currently representing in the forum, who are members of the forum. It's 2,100 members. It's one platform where it's run by carers, not by any union or anybody who's not in the situation that we are faced. In the organization, we've decided that we need some activities that is going to give a momentum to the struggle and also pushes the department to give us answers in due course that we are needing them, which is why we are having these mini campaigns.
I think the relation between Kenya and the forum kind of has developed over many years. I think the first phase of that relationship was getting them to accept that Kenya is not an organization that will do things for them as carers. I mean, the idea to carers is that it's important for them to take the position that they should speak for themselves, and that they should be allowed to speak for themselves. It's not, it's really a short-sighted view to be afraid of what the carers are going to say. And if an organization doesn't give enough space for that freedom from below, it's also denying itself the originality of ideas. We always said you can take movement after movement for the last 100 years. The best ideas always come from your membership. If they have the space to express them, if you have the most difficult thing, the most innovative ideas, that's where you get them. And as Kenya, we kind of said we're setting ourselves some targets for the forum to be less and less dependent on Kenya's assistance, and it's kind of we getting there.
I joined Kanya College in 2010 under Seti Samsadi. From that time, I started to work with CHWs because we were being approached by the CHWs for Kanya to help them. It's just that time, they were only, the leadership was only male. Where that's when the problem started, because even though 100%, maybe 99% of this work is led by women, but they only want male to lead them. Looking at Zolaga as the chairperson, maybe just to give a brief. Zolaga, it was a kind of a person when she's coming to Kanya activities. For example, if maybe she was attending winter school, she will be complaining that, no, I'm not used to sit a long time, I'm used to go to the field, now I have to sit and listen to the politics. But now look at how she is a leader. How leadership she is. She can lead the forum, she can do whatever, as long as she needs, like, she always like know what to do.
I've changed a lot because some of the family things to me are just minor, because I'm just focusing on what it is that I want to see at the end of the day, the challenges that the carers are facing. I don't want to see someone else in the same situation. I sit with old people who have done this job for a very long time. They're telling me, like, I've been in this field, I grow old in this field, and what it is that I'm getting when they say I must retire. Nothing. That is what makes me change a lot, to say I'm gonna fight this thing. So it changed me personally because of the passion that I have for this field, the passion that I have for being a community healthcare worker. That's not a passion of being the chairperson of the forum. It's just a passion of, I know what I want. I know that I want this job that I'm doing to be a professional job.
How to create solidarity and have one voice. The formation of the national structure will create national solidarity and unity amongst HWs in South Africa.
Okay. Now that the comrade summarize resolutions, do you think do they reflect the actual discussion and things that we said? Summarize meaning shoot is not a verbatim. Can we have indication if are we adopting these resolutions? But the full resolutions with the full flashes are Azolander. They will actually follow.
I think the outcome of the summit, the decision that they have taken to organize, to wanting to set up a national structure, is very important. But social change processes, yeah, in a country like South Africa, where you have the destruction, the damage is done in hundreds of years. It's nothing in which will happen in 3 years or 4 years or 5 years. Social movement building, that's a long process. So that is a big challenge. It contradicts with the usual business, the usual aid business. And as Medico, we try and actually still organize the support in a way that the growth of a movement can happen organically. And we won't make everything dependent on availability of government funding or other funding. That's why we also mobilize private donations of individuals, which we can use then to support project partners even beyond public funding cycles. And we try and communicate this also, that yes, politically we want to be becoming irrelevant as soon as possible, or even from the beginning. But when it comes to resources, yes, it's a responsibility to redistribute resources, I think. And maybe that's the best position you can have as a German organization and person in a struggle like this.
I feel like crying, but the tears were the joy tears, saying that, oh God, thank you. We did it. We did it. Because knowing, to come with a thing like summit, it's not a small thing, and it's not a simple thing.
because you need to group people together, get them together, so that the thing can happen. So for me, it was a good thing. It was an opportunity of being standing there as a CFW, doing all the thing that was happening in the summit. And what I like is the summit is that no one did the job for us. It was us who was conducting the whole thing of the summit. It was CSW summit. It's like no, we didn't send anyone go and speak on behalf of us. We were standing there and taking out the problems. So for me, the summit was great. Yes.
Shiniwa,